The night shift begins with the hum of fluorescent lights and the soft hiss of oxygen. The corridors of the Royal Hobart Hospital gleam like polished bone. Somewhere down the hall, a patient yells. It's the kind of sound that barely turns heads anymore. "Another one," mutters Jess, an emergency nurse with 17 years under her belt. Her hands are dry from sanitizer, her eyes dulled by routine exhaustion. She looks up at the clock, 8:03 p.m., and pulls on another pair of gloves. "You get used to it," she says, but her tone makes it sound more like surrender than acceptance. In Tasmania's public hospitals, the idea that abuse, both verbal and physical, is just part of the job has become as unshakable as the smell of disinfectant. From Launceston to Burnie, nurses, orderlies, paramedics, and receptionists all carry the same quiet scars. Some are visible, finger-shaped bruises on wrists, scratches that peek out from beneath sleeves. Others live deeper, tucked behind polite smiles and rehearsed calm. One, the language of survival. It starts small, they say, a raised voice, a slammed fist on the counter, a drunken accusation, "You don't care about me." Then it escalates, spitting, pushing, threats. "I had a patient once who threw a urine bottle at me," says Callum, a young doctor working his second year at the Northwest Regional. "He was delirious, but that doesn't make it easier. The thing that gets you isn't the shock, it's how everyone just shrugs after, like, well, that's how it goes here." The staff develop a kind of shorthand. Agro in Bay 4 means raise your guard. Code Gray means call security, but don't expect them to get there fast. And the unspoken rule, don't take it personally. But how do you not take it personally when someone screams that you're worthless, when a patient spits in your face, or when you see your colleague crying quietly in the linen room after being cornered by a drunk man demanding painkillers? 2, the sound of resilience. On the ward, the air carries a constant hum, machines, footsteps, low murmurs. But under it, there's another rhythm, the pulse of restraint. Staff practice it like a second language. "Keep your tone calm," the training manual says. "Diffuse the situation." But manuals don't mention how to steady your hands when someone threatens to stab you with a pen. They don't tell you how to carry that adrenaline home, how to sit at your kitchen table an hour later, eating cereal in silence, pretending it's fine. Jess remembers one night vividly. A patient came in high on meth, swinging at anyone who got close. Security was short-staffed, so it was me and 2 other nurses trying to keep him safe, and ourselves safe until the sedatives worked. Afterwards, I went into the supply room and just sat. Didn't cry, didn't shake, just sat there and felt empty. She pauses, picking at the edge of her ID badge. We're supposed to be healers, but sometimes we're just targets. 3, the invisible toll. The numbers, if you read them, sound sterile. Over 1,000 reported assaults on healthcare workers in Tasmanian hospitals each year. But reported is the key word many aren't, because paperwork takes time, and time is a luxury. "I didn't report the last one," admits Maria, a midwife in Launceston. "A woman in labor hit me across the face. She was terrified, in pain. I understood, but it still hurt. And I thought, what's the point of writing it up? Nothing changes." What changes instead is the people. Burnout, chronic anxiety, insomnia. Some develop what they call hospital heart, a numbness that settles in when caring starts to cost too much. They stop flinching at insults, stop reacting to threats, stop expecting thanks. It's not that they don't care anymore. It's that caring too deeply feels like a liability. 4, a system under strain. Part of the problem is structure. Tasmania's health system has been stretched thin for years. Underfunded wards, staff shortages, rising patient loads. Emergency departments, once designed for short-term crises, have become holding pens for society's broader ills: mental illness, addiction, homelessness, despair. "Half the people who lash out at us aren't bad," Callum says. "They're just desperate. They're cold, in pain, off their meds. They've been failed by every system before they get to us." Still, compassion has its limits. When abuse becomes background noise, something vital erodes, not only trust but dignity. One night, during a rare lull, Jess walks past the staff notice board. There's a poster that reads "Zero tolerance for violence." It's been there for years, edges curled, corners yellowed. Someone scribbled beneath it in Beiro, "Tell that to the night shift." 5 between duty and damage. In the cafeteria, over reheated coffee, the talk circles the same drain. We need more security. We need better mental health support. We need the government to listen. But beneath those practical demands lies something more human, a plea to be seen, to be acknowledged. Because in public imagination, nurses are angels, doctors are heroes, and hospitals are safe havens. But the reality on Tasmania's night wards tells another story, one of quiet endurance, where compassion and trauma lie side by side. Maria once had a patient who apologized the next morning after a violent outburst. He cried, called himself a monster. She told him, "It's okay," because that's what you say. But later, driving home past the Derwent River, she pulled over and sobbed until the sunrise blurred in her tears. "It's not okay," she whispers now. "It never was." 6. The fragile hope. And yet, amid the exhaustion, there's light. In the shared laughter between shifts. In the silent nods of solidarity when a colleague steps in before you even ask. In the moments when patients, sober, lucid, grateful, say thank you and mean it. Jess remembers one such moment. "There was this old man once, dementia patient, used to lash out a lot. One night I sang to him Waltzing Matilda, just softly, and he stopped yelling. Looked at me like he remembered his daughter, held my hand and said, 'You're a good girl.' I still think about that." She smiles faintly, then shrugs. "You have to hold on to the small mercies, otherwise you'd never come back." 7. What the walls hear. If the hospital walls could speak, they'd tell stories of kindness and cruelty in equal measure. They echo with both gratitude and grief. They'd whisper of nurses wiping blood from their uniforms before heading home to kiss their children goodnight, of doctors swallowing fear behind professional calm, of orderlies who stay late just to make sure someone isn't alone. This is the quiet war fought in Tasmania's public hospitals, not against disease, but against despair. A war without medals, without frontlines, without rest. And though the staff wear no armor, they keep showing up. They patch each other up between shifts, swap dark humor in the tea room, and somehow keep believing in